Thank you very much. My name is Gikonyo. I am a kidney patient living with a transplant for the last 10 years. I'm also the president of the Renal Society of Kenya. And thank you for having me.
What are some of the challenges kidney patients and patients who have had transplant are going through currently that they urgently need to be addressed?
Kidney disease affects about 10% of the population. So the first problem is all those kidney patients who don't know that they're patients, because a lot of them do not know. And the only way of knowing that is going for a screening. Whether you are healthy, whether you feel well or not, you should be screened at least once a year to know the general status of your health and also your kidney health. And this prevents a lot of problems. Now, once you become a known kidney patient, you're living with a dialysis or a transplant, then there are all manner of interventions that are available in the country. And since 2015, we've had a renal package under NHIF and now Social Health Authority, which caters for 2 sessions of dialysis per week. And with the introduction of Social Health Authority, we now have a cover that is also including post-transplant cover. That is covering medication and covering medication and laboratory tests that one has to do regularly. It also includes pre-transplant evaluation, that is the evaluations, the tests and the workups that one needs before they can be able to get a transplant. And it's also paying about 700,000 shillings.
You've analyzed the package under SHA, but the question I'm curious to know the challenges that are being experienced.
Challenges mostly is one, lack of information. A lot of patients are groping in the dark. They don't know where to find help. And the reason they don't know that is because they don't have the information where that help is, which is why it is important, for example, to be in a patient's group where some of this information is shared. Secondly, access. Some of the benefits package that I have explained are only accessible at KNH and teaching referral hospital. For example, the post-transplant package, that is payment for medication and payment for laboratory services, is currently only happening at Kenyatta National Hospital and Moi Teaching Referral Hospital. Now, what these two have in common is that they're public hospitals. So we have about 8 transplant facilities in the country. Only those two are having that package available because the others are private. So it is good that people who are living in clinic conditions familiarize themselves with that information. The transplant package, sorry, not transplant, the dialysis package is available throughout the country in county referral hospital and private facilities that offer dialysis services. So that one is freely available. But again, there are people who do not even know that there is a dialysis package and where to find it.
In terms of affordability, can you say kidney treatment in the country is currently more affordable compared to in the past?
Yes, it is more affordable. First of all, kidney treatment is very, very expensive. Let me give you an example. Currently, a session of dialysis is costing 10,650. You are doing 2 per week. So if you take 10,650 times 2, that's 21,300 times 52 weeks. That will bring you to about 1.1 million shillings. A lot of people can't afford that, but that is being paid for. So previously, people would pay out of pocket before 2015, but now government through Social Health Authority is catering for that. Pay out of pocket before 2015. But now government through Social Health Authority is catering for that. Transplant can cost anywhere between 1 million to 4 million shillings. SHA is paying 700,000. Transplant is almost free now in public hospitals, Moi Teaching Referral and KNH. So I would urge anyone who is thinking of a transplant to look at those two hospitals. Those ones with a little bit of money can look at private hospitals, which also have some reasonable prices for treatment. But like I've said, post-transplant care now is, I wouldn't say fully covered, but it's lately covered. So that has also eased the burden of out-of-pocket expenses for patients living with kidney disease.
Lastly, in terms of outpatient cover, does this cover also cater for outpatient cases, especially like when say you don't have, you're not coming for a dialysis, but you have other conditions that you don't have to go to the wards and all that?
Now,
and how is your experience so far and the people you represent?
The renal package is specifically for renal matters. But remember, when you are a member of the Social Health Authority, you also access all other services that Social Health Authority gives. The challenge that a lot of people have is that some of these packages have not been activated simply because nobody has gone knocking and asking why is this not activated. And I'm saying this because that's how we got the renal package activated. We went to KNH, we demanded the service, we were told by KNH the service is not available, so we went to SHA and asked why is this not available, and through that back and forth, KNH and Social Health Authority were able to sit down and now create the modalities of how that package will become available to the patient. So I would challenge other patients, when you go and find there is a benefit or a treatment service that you require that is not available, don't just go home and get served. Just go knock at doors, push, find out why isn't this help available. So that's what I would urge people to do. Push, push, push.
Lastly, any parting shots?
I would probably like to tell people that the only way you will know whether SHA is working or not is to get it. If you are not a member of Social Health Authority, you have not registered, you have not paid up, and you're saying it's not working, of course it's not working. Of course, you're not inside. Once you are inside and something is not happening, something is not working, start pushing, start knocking at doors so that whatever is not happening should be able to happen and you should be able to enjoy benefits. One of the saddest bits about this whole SHA thing is that some of the packages that SHA is willing to pay for are unfortunately not available in the facilities, particularly in government facilities where you have a lot of people who go for this. So you may want a procedure that SHA is willing to pay for, but you may be told to wait until August or until December or January because there is a long queue of people waiting for the same services. The facilities are strained, the equipment is inadequate. So we would like to urge the government, both national and county, to kindly equip hospitals so that they are able to respond to the needs, the health needs of their people. We know that, for example, there is the facility improvement fund that we don't hear a lot about, but which would have been rolled out around the same time with when SHA was being rolled out. We want that activated, and we want facilities to be equipped, to be given the equipment that they need, to be given the personnel that they need, because that's also critical, so that they are able to respond, and whichever service SHA is willing to pay for is available to the patient whenever they seek that service. Thank you.
Thank you so much for your time. That was